Information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to an episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living. My name is Yosifia Spence, and I'm your host today. I am the health educator for the Health Promotion and Wellness Office at the Department of Health. Our topic today is health happenings with a focus on Vaccination Week of Americas in April. My guest today is Nurse Geneive Williams-Hart. Nurse Williams-Hart, will you please introduce yourself, let us know what your position is and your program?
Good morning. Thank you, Yosifia. My name is Geneive Williams-Hart. I am the acting EPI manager for the Department of Health. And yes, we are looking forward. We celebrate Vaccines Week of America every year, and it's the third week in April that we celebrate along with the Americas region and the Caribbean.
And so today our discussion, our focus really is to look at Vaccination Week. What does it mean? Why do we celebrate it? And what are some of the things happening with Vaccination Week of the Americas for this upcoming year? And so first, Nurse Hart, can you please just give us a bit more understanding of what is the EPI program and, what is the purpose of that program?
The purpose of the EPI means Expanding Program on Immunization. And this program is basically projected towards the improvement of vaccines from all ages, basically from the children. We focus on the kids first from 0 to 18 and then above the entire region of your lifespan. So vaccine, we do this in order to promote vaccines, educate the public, and to let everyone know how important vaccine is to protect the community and protect yourselves.
Thank you. That was very informative. And so can you tell us when is Vaccination Week of the Americas this year?
The Vaccination Week of Americas is on the 21st of April to the 27th this year. And the theme that we're using is Engage Now to Protect Your Future, Get Vax. So every year you get a new theme that works towards the promotion of being vaccinated, because we're trying to push people to get in vaccinations or immunization and let them know how important it is to protect themselves.
I mean, I would take from that theme this year that Engage Now to Protect Your Future is that, taking that step to get those important vaccines that are necessary for your age group or for you as an individual based on whatever your doctor may say. That's saying, okay, in the future, what does that mean for your health when it comes to immunization? So that's a really powerful theme. And so what can you tell us, what are some of the things that you typically do to celebrate Vaccination Week of the Americas?
So for Vaccination Week of Americas, we try to promote it as much as possible. So we do the wave at the Crow Lane on the first Monday of the week. So we will there, a group of us will be there, nurses and anyone in the department. We welcome everyone to come and help us support the week and celebrate the week. So we're there with our Bermuda Army and we'll be waving from 7:30, meeting the cars coming from the west, and to 9 a.m. And basically, the minister does do an opening of the week for us, so that will be arranged as well. And then moving forward in the week, I do have an EPI workshop, which involves all the healthcare workers across the island who works with us, our stakeholders, and that will be on the 24th of April, from 9 a.m. to 3 p.m. So that we will send letters out to them and invite them. We'll be having an open house clinic for everyone who needs any immunization from a child to an adult, we're trying to support. However, I'm focusing on the MMR vaccine. As you know, measles is around, and it's not said to be in Bermuda as yet that we know of, but we're trying from the department to promote measles as best as possible to let people know the importance, because measles is a very dangerous disease.
Right. And you said it's not here yet, but I mean, this is Bermuda. It's highly traveled. What is the significance of that and the dangers when it comes to our exposure?
Well, exposure-wise, like I said, it's not here as yet, but we do have a high level of traveling and turnover. So, it's in the U.S., it's in England, and we have, flights coming daily from these regions, and like I said, anyone could bring it across to us. So we have to prepare ourselves for this, and I do hope and pray that we don't get it in Bermuda.
Nurse Hart, can you tell us a bit more of why MMR and measles is so dangerous for a person to contract or to our population?
Okay, so measles is one of the most serious diseases that could occur to a child or anyone, and this disease can affect both children and even babies and adults. This disease, when you get affected by measles, it can cause death, because it's that serious. And the appearance sometimes with measles will be like a rash, you can have fever. So sometimes at this time we have to be very careful, because in this century we haven't seen it, and most of our young healthcare workers have never seen measles. So with our surveillance and all of this have to be so important, that do not let anything slip, because the least thing that you suspect of measles, you have to report it and pay very good attention to that. Measles can cause a person, like I said, to die, and you can get an infection of your brain and on other lung problems, like pneumonia and stuff along with it. So, it's a very, I wouldn't say that, very bad, serious, dangerous disease.
Okay, and so those are some of the symptoms that come with contracting the measles disease. I mean, what do people need to look out?
It is very contagious as well. Okay. Meaning that if you're in the household, somebody get it, everybody could have it. So it spreads. So it could become another pandemic or epidemic like the coronavirus did.
Right. So this is why MMR is a major focus for Vaccination Week of the Americas this year.
Because with it already in other countries, and like I said before, we're trying our best in Bermuda to promote, to let people know that measles is a dangerous disease. So if possible, and I know other parents, they have the right to make these informed decisions for their children. But I'm trying to say, do you want your child to get this disease? Nobody wants your child to get ill. So just think about what you'd like for your child and your family members who don't have it, and make that right decision.
Right, and you talked about vaccine hesitancy earlier, and you talked about also the decision making. And so how can persons within our community feel more secure in making the decision to vaccinate their family members or themselves?
So what they need to do is to speak to their healthcare workers. If they have a physician, if they can come to the Department of Health and speak to any one of our nurses, and they need to ask questions to the healthcare providers. And our healthcare providers have to be able to explain to the client and give them the information, listen to them, and speak to them and explain to them the reasons for having these vaccines, the importance of having the vaccines.
Yeah, I mean, understood that could be dangerous for our population.
It can be.
Are there any other vaccines of focus or any other topics of focus this year?
So I would like to focus on the HPV. HPV is the human papillomavirus vaccine, and this vaccine is the one that's given to kids between 10 and until they can have it up to 30 years old. Because this vaccine is the ones that it was pretty new, came out in 2010, 2011, and this vaccine prevents you from having like cervical cancers, any of the cancers for the rectum, the penile area, and like that. Okay. So we promote this vaccine, and I know it's new still to parents, but in the future, like they had the slogan said, you're preparing for you get vax for the future. Yes. You wouldn't like your child to end up with something in the future, and then you'll say, if I had known, I would have.
Right.
The vaccines build up your immunity, and even if you should have a disease, a vaccine-preventable disease, and you got the vaccine to prevent it, you would not have that disease as badly as someone who had not had the vaccine.
So the severity could potentially be reduced.
Right, will be reduced.
So can you just give us a little bit more about what vaccine-preventable disease, is this phrase that we hear, vaccine-preventable disease, and what does that mean? Can you give us an example of vaccine-preventable diseases outside of our previous discussion on MMR and HPV?
So vaccine-preventable disease we call it VPD. So this means it's a series of diseases that can be prevented from vaccines. There are vaccines that can prevent these diseases. So, for example, about chicken pox. We have a vaccine, and our term would be varicella for it. So you could get that vaccine. About the measles, mumps, and rubella, which is the MMR. You can get that vaccine to prevent it. You have the tetanus and the diphtheria vaccines, so we have vaccine to prevent those diseases.
Okay.
And like way back in the day when you had the smallpox disease, remember they created a smallpox vaccine, and that's what helped to diminish smallpox.
Right. So I mean,
and the
from
polio.
My knowledge, smallpox is eliminated.
Yes.
And so vaccines can help to protect or potentially in the future eliminate certain vaccine-preventable diseases?
Yes, it can.
Okay. I mean, I feel like we've gotten a wealth of knowledge just about vaccines in general. And how is the vaccine uptake in Bermuda? Has it been declining, increasing, or is it stable right now? How important is it in terms of our uptake and numbers that we get?
So our numbers have been fluctuating since the COVID-19, and this is not just Bermuda. It's been I've been to meetings. It's everybody in the region. So that is why we emphasize when Vaccines Week of America, we try to do more campaigning and try to do more education in trying to get people out and educate them about the seriousness of not getting vaccinated. So some of our vaccines that are really low, it's like our MMR number 2, because MMR is 2 doses. Most time people will take the first one, and then the second one they never turn up to take the child to have the second one. Sorry. And then the HPV again, because it's new, we're having an issue with that as well. Like they're not compatible, so we have to do a lot of educating. And then, unfortunately, I have to say it is that we have vaccine hesitancy around us, and it's not just here, it's everywhere. So we have to try and do more education in the schools and in the community, the churches, everywhere.
Okay. So you mentioned MMR2 and that being a second dose. So for some vaccines, they require more than one dose or some type of booster?
So for some of the vaccines, there are more than one dosage. So like MMR is 2 doses. A child will get one we're trying to change, it's like 2 years and then at 4 years.
Okay.
But some cases, you can give it earlier depending on the circumstances and the doctor will agree to give the child.
Wow, so we've had a really robust discussion this morning, and I'm looking forward to some of the activities and celebrating immunization in Bermuda, and looking forward to Vaccination Week. As you said, this is a yearly celebration, and we can celebrate the positive things that vaccines have done for our community. So can you tell me who can participate in these activities that we do have coming up for Vaccination Week?
So everyone can participate. Anyone who would like to come and join us on the Monday by waving down at Crow Lane. I'm glad to have you there to come and help us celebrate the Vaccine Week of Americas. On the opening, which will be at the City Hall when the minister is launching the week. Everyone is welcome to join that as well. And on the Wednesday, this is just for health professionals.
Okay.
So that would be a private workshop just for professionals in Bermuda.
And then you have the clinic.
And I have the open clinic, and like I said, everyone is welcome to come in for their vaccines. And I would like the parents to, take the kids in to protect them, so we can protect our children for the future, as our ad said. So that's what we're trying to promote.
Okay, that's great to hear. So basically, our main thing is that we do want to promote vaccination within our community. We want people and our families to engage now to protect our future, right? The futures of our families and our communities. And so, Nurse Hart, I just want to thank you for coming in today to have this very important discussion. And I'd like to know if you have any final words to encourage our community to engage with Vaccination Week, or even just a bit more understanding of vaccinations in general. Just any final thoughts that you can share with us.
Thank you for having me. I just want to let people know that vaccines are safe. And vaccines protect us. And I like to say that it protects you, the person, it protects their family members, and you protect your community. And for us to move forward and have a healthier community and a healthy Bermuda, we need to think more about protecting each other. And like the slogan say, engage now, meaning get your vaccination. And for the future, we should have a healthier and a better Bermuda.
Thank you so much, Nurse Hart. This has been Bermuda Health-Abets, everything from A to Z on healthy living. Thank you for listening.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.